I'm Elin Nisley and I'm a medical assistant. I would say I think coming up on 10 months, and I've been doing this specifically. It started out a little bit slower. I would do it maybe once or twice a month, and now I think we're at 10 sites every month. We're in each city twice. So I'm doing like 5 or 6 days a month. Not super long. You're the person in the office that's kind of managing the flow for doctors. So you're making sure patient charts are updated, the schedule looks good, getting them in and out of rooms for the doctor. So you can get certified for it. Or I came in with experience. I worked inpatient in a hospital for a while. And so then I wanted to kind of switch to outpatient. So I have, I think, 2 years of experience coming in just doing direct patient care, which helps. I would say the workflow is a lot nicer. Do some admin work. We have kind of a check-in person and then get our vitals. And I think that the outside of this is a little bit more friendly. I think ambulances tend to scare people off, which is fair. It's a little more inviting and people are more curious. Just they're even coming up asking, even if they're not getting anything, and we can, give them pamphlets or information for whatever they need. Word has definitely really gotten out and people are getting more comfortable with the idea of going into the van. Scheduling follow-ups, I think, has been really big. A lot of people are getting their HPV doses, so they'll come in for their first one and then 6 months they'll get their second and their third. And then some people that live around are telling their friends. I think the girl we just saw, her sister came, or her cousin needs her blood pressure checked. Like, we can do whatever in the realm, for what people need, even if it's just getting vitals and then going about their day.
My name is Shanika. It's actually wonderful. It makes it more convenient for us. And it was very comfortable and very professional, getting care on a van, it seems. I actually live 2 streets down. I was riding past and my intentions were to get some care recently anyway. And when you don't have a vehicle, and it's right here in the community, it makes it so much better. So yes, coming in our communities and making it convenient for us is a plus. We sure appreciate it. Our communities need it, and we really do appreciate it. We do.
So I'm Dr. Candace Jones. I'm a certified nurse midwife here on the mobile unit. Having a mobile unit is more convenient. We're able to offer our patients more versus what we had on the back of the ambulance. And I think we're more visible in the community now also versus an ambulance that people just think, oh, they're there for some emergency. And even though we had our little sign, I don't think it did justice like having our own unit. And we also have now the ability to do colposcopy. So if we screen a woman and she has an abnormal pap smear that needs a colposcopy and she doesn't have insurance or doesn't have a home GYN office, we're able to do it right here on the bus. I think they're very grateful, and I think we are grateful that the services are there too, because we know the risk of them not getting treatment, not having a colposcopy, not having follow-up. We know that that's why we have these higher cancer rates. So our ability to be out here and offer these services makes a big difference. And I think everyone's appreciative. Even patients who we've seen and they see us out, they'll come by and say hi and, just check in with us, not necessarily to be seen again, but they check in and say how grateful they are. They bring their sisters or their cousins. So I think the community really appreciates it. The benefit of us being here today is it's their food bank day. Those are the people that need our services. So they come in to get the services from the Y and they see us here, and the Y has really been promoting us. So then that helps us reach more patients also. And then we're here, so if they have insurance, we're able to connect them with our office, the UPMC offices in Uptown Harrisburg or Downtown Harrisburg. We can get them to a home office if that's more convenient. If not, they can come back and see us on the mobile unit. We are able to connect them with a social worker. If they need mental health services, we're able to connect them with that. If, say, we're not here, but we're somewhere that doesn't have a food bank and they need those services, we're able to connect them with all the community services they can need. We love, 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 love Universal Media, and we are so grateful for their donation and us being able to have our unit. Not only us, but the community. There's not enough words to express how much of a blessing this truly is. And I would say I've been in medicine for a long, long, long time. I think this has been my most rewarding job, being able to be out here with these individuals and help them and meet them where they're at.
So my name is Laura Feliciano. I am a medical assistant for the Women's Cancer Center. So Denise presented this amazing opportunity to come out to the community and just help service women. And when I heard about this, I immediately wanted to jump on it because So the physical space is amazing. I mean, it almost feels like a little office on wheels. So we did encounter a situation that we probably thought was sex trafficking, and us coming and talking to these young girls, showing them that it's safe, that it's okay to be vulnerable, it's okay to talk about the things that are going on, and then also providing those resources, right? So that they can come out and know that they can be freed from what they're living. It's really setting that environment and that friendly face for them and just getting to know them, right? Because then next they'll come here to the mobile unit and they're like, okay, I know you. Now I feel comfortable walking up and talking to you about the things that I need. There's something special giving back to the community, and more specifically women, right? I work at a women's cancer center, and if we can help prevent the kind of things that we're seeing in the clinic, reaching out the community of the ladies here that can't go to offices, like why not? But also more personal for me. At one point in my life, I didn't have medical insurance, and I found myself in the same situation, like where do I go? What doctors do I go to, So it's more of helping those ladies because I know where they're at, and even just touching the community and making our presence known. Absolutely thankful for Universal Media for providing the resources for us to being here. But it's changed our dynamic in a way that we can come here and just talk about what the importance is of being screened and talking to your doctors and your providers. And it's built our connection more as a team, because we can lean on each other in ways where one is more comfortable doing one thing, the other steps in